Hello there. This is the patient assessment medical skill. Our scenario today is a 27-year-old female who was at the fairgrounds when she was envenomated by a bee. Patient has history of bee allergies. First, I'll make sure I have on my standard precautions, my safety glasses and my gloves, and the scene is safe. And of course, this appears to be one patient. She appears to be a medical patient. I will consider additional resources like ALS, and I will also consider C-spine throughout the entire call. I'm approaching my patient, getting my general impression. What I'm seeing is a young female patient sitting up on a park bench. She's leaning forward, holding her chest in obvious distress. I don't see any life threats at this moment. I'm going to approach her. I'm going to introduce myself. Hi, I'm John. I'm an EMT. I'm here to help you. What's your name? And she says it's Amy. And Amy knows that she's at the fairgrounds, and she also knows that it's Wednesday. So at this point, she's alert and oriented times 3. Amy, why did you call us here today? And she says that she has shortness of breath from the bee sting. So her chief complaint, of course, is the shortness of breath, and she's for alert and oriented times 3. She is talking to me in somewhat full sentences, so her airway is open. I'm checking rate and tidal volume of her breathing. I see adequate rise and fall of the chest. It's rather labored. And of course, I'll put a pulse oximeter on the patient's finger. I get 86% on room air. At this point, I'm going to have my partner put a non-rebreather mask on at 15 liters per minute. The patient accepts that treatment. Next, I'm moving to circulation. Looking for any obvious life-threatening bleeding. I don't see anything obvious there. I'm going to check a radial pulse, and it appears weak and rapid at the radial site. Her skins are flush, warm, and moist, and I can see hives developing on her face and her arms as well. At this point, based on her presentation, she's a priority patient, and I'm going to transport her as rapidly as possible off scene. So, Amy, what were you doing when this started? She says she was sitting at a bench taking a rest when she thinks she sat on a bee, and her symptoms came on rather rapidly. Nothing really makes them any better. And I know that you're having problems breathing. What does that feel like? Can you explain what the feeling is you're having with your breathing? She says she can't get air out very well. She can't really breathe out very well. It's kind of difficult with that. And she really says that nothing's really radiating. Nothing really reoccurs. It stays about the same. On a scale of 1 to 10, 1 being the least and 10 being the worst, comparing it to your previous reactions, can give me a number. And she says it's a 10. It's the worst she's ever had in her experience anyway. And I know right now it's about 11:30 in the morning. When did this all come on? She says about 15 minutes ago. Amy, do you have any other allergies besides bees? And she says no. Do you take medications on a regular basis? She says the only medication that she's on, she has EpiPens. Unfortunately, she left hers in the car. She doesn't have it with her. Luckily, we, of course, carry it ourselves. Any medical conditions you're treated for at all beside the bee stings? And what's the last thing you ate? And she says, I had a hot dog and a soda about an hour ago. And I know that you have had exposures to bees before, you've had allergic reactions to bees before, but is there anything else, say, you could have been exposed to? The foods you ate or chemicals you were exposed to, anything like that? She says, no, this is what happens when I have my bee envenomations, and this is pretty indicative of that. Some clarifying questions. Do you feel dizzy? And she says, yes, I feel a little dizzy. Do you feel nauseated? And she says, yes, I always get nauseated when I have a reaction like this. Do you mind if I do some inspect areas of your body? And she says, yeah. So there's some modesty screens here and all that. So I'm going to lift up her shirt with modesty, and I'm looking. I do see hives. I'll obtain a set of lung sounds bilaterally, second, third intercostal, fourth, fifth, and then subscapular. I hear expiratory wheezes in all fields. She does have some swelling to her lips, around her eyes, and she has some hives to her arms and to her chest. Obvious signs of some kind of anaphylactic response. I do notice that, or I ask her that what's happened to the stinger, and she says she's removed it prior to our arrival herself. So there's only one envenomation, and she removed that stinger prior to. If it was still in there, I would scrape it away with some kind of credit card or stiff plastic device to get it out of there. I'm going to take your vital signs right now. So I'm going to check a pulse. I'm going to count 30 seconds times 2, and I get about 110 weak and regular at the radial site. My blood pressure is 88 by palpation. She's breathing about 26 times a minute, labored, but somewhat effective. Saturations have come up to 90% on the high flow O2 with this. So based on my field impression, I have a female patient who's been envenomated by bees. She has bee allergies. This, what I'm seeing now, is one of her worst responses to it. I'm going to treat her for her condition based on medical direction and standing order per the County of San Diego. I can administer up to 1 dose of epinephrine given intramuscularly. So Amy, I have the EpiPen here. You've had this before. It's going to go into your lateral thigh. First, I want to check my 5 rights. So it is epinephrine. It is for allergic reactions, which you're having right now. It's 0.3 milligrams. It's not expired, and it's given intramuscularly. I have my partner do a triple check, make sure that the medication is being prescribed correctly. Also, the only contraindication is weight-based. And how much do you weigh, Amy? And she says she weighs 110 pounds, so she's well over that 73-pound range for this. She's an adult dose patient here, so I have the right pen. Which you have a preference of thighs, and she says she prefers her left thigh. So I'm going to take off the safety cap, and I'm going to lift up her pants, or her shirt, or skirt, whatever it might be. I'm going to find the soft part of the lateral thigh, and I'm going to push in. I'm going to hold the leg as I push in, and 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000, 7, 1,000, 8, 1,000, 9, 1,000, 10, 1,000. I'll put this into a sharps container, and then I'm going to get the patient on the gurney, start transporting to the hospital. I'm going to reassess my patient. I'm reassessing her ABCs, LOC, and Glasgow Coma Scale. She still remains fully oriented. She's still breathing adequately. No obstructions to the upper airway that we can hear right now. I'm going to reassess my secondary assessment, looking for any envenomations that I might have missed. I'm also seeing how or if the hives are receding. I'm going to listen to her lung sounds to see if the wheezes are receding as well. I also notice that her pulse oximetry is coming up to 98% on the high flow O2. I'm going to reassess her vital signs every 5 minutes. Updated blood pressure is 110 by palpation. Heart rate's 120, strong and regular at the radial site. The skins are becoming, they're still a little moist, but they are pinking up, and they're kind of pink, warm, and a little moist right now. She feels a lot better. Originally, it was a 10 out of 10 scale. Her breathing's down to about a 2 out of 10, so we're going in the right direction with this. When we get to the hospital, I'm going to turn this patient over to the nurse. Hi, this is Amy. She's 27 years old. She's at the fairgrounds today. She was envenomated by a bee when she sat on it, when she sat down on a park bench. Patient says she's had this reaction before. This is one of the worst reactions she's ever had. It came on very, very quickly. We found the patient sitting up in obvious distress, breathing about 26 times a minute. She has expiratory wheezes in all fields. Room air saturation was 86%. We did place her on high flow O2, which bumped it up to about 90% after a few minutes or so. Heart rate was 110, weak and irregular at the radial site. Skins were flush, warm, and moist. She did have some rash to her chest, her arms, and also some swelling to her lips and around her eyes, some angioedema to her face. Our treatment was high flow O2, and we provided with 0.3 milligrams of epinephrine given intramuscularly. After that, she says she feels a lot better. It's about a 2 out of 10 scale now. She's breathing a lot better. Her wheezes have almost all cleared up. It's out to 98% on the high flow O2. Blood pressure is 110 by palp. Heart rate's 120, strong and regular. Skins are clearing up as well. Do you need anything else?